Hi, I'm Daniel Nyman. On behalf of the Forum for Healthcare Strategists, as well as our partners at Invoca, welcome and thank you for joining us. In today's webinar, we'll tackle the important topic of reimagining patient journeys for better experiences across digital and human connections. In the era of personalization and convenience, reimagining the entire patient journey is a must for healthcare organizations. Today, we'll examine the technology, data, and teams that are reshaping access to more humanized care. Our speakers today are Joanna Laytin and Jennifer Bassik. Joanna is Vice President, Brand Marketing at University Hospitals in Cleveland. Joanna has 20 years of experience using consumer insights, qualitative research, and quantitative analysis to develop marketing strategies for Fortune 100 companies, government agencies, and nonprofits. Jennifer Bassik is a Senior Director of Growth Marketing at Invoca. She brings her experience as the Vice President of Product Marketing plus Strategy at Dialogue Tech to define new go-to-market opportunities with key verticals and channel partnerships. One note before we begin, attendees are participating in listen-only mode, but you can still ask questions. If you have questions for our speaker, please enter it into the question and answer pane located on the bottom of your screen at any time. We will respond to as many questions as we can in the time that we have. With that, I'll turn the program over to Jennifer Bassik. Jen?
Thanks so much, Daniel. And hi, everyone. Thank you for joining today. Over the next 45 minutes, we are going to be exploring all the different ways that you can rethink patient journeys at your organization. And what practical advice can you take back as marketers to help shape those experiences? I come from Invoca, which is a conversation intelligence platform. And what that means is we provide insights to the online to offline patient journeys, particularly when a phone call takes place. And so as the name of the webinar suggests, we will not only be looking at all the digital channels and the digital interactions that you use as marketers, but we're going to be talking about those human connections, the live voice-to-voice, face-to-face, one-to-one, real-time conversations that are also vital to patient experiences. And so we're going to talk about how those two things can coexist. Our goal for today is to have you walk away with practical advice that hopefully you can take back to your teams even as of today. And so today we've got three outcomes. One is to talk about marketing-led insights that improve patient scheduling and staffing efficiency. We're going to explore personalized messaging in ways that you can meet patients along in their journey. And lastly, thinking about a feedback loop that you can create to eliminate silos across teams. So if we're talking about patient journeys, let's start with this idea, this concept that you are likely very ingrained in and talking about daily at your organizations. And that is, what is the state of patient journeys today? There's a concept of consumerization in healthcare, which I know is very highly impacting your day-to-day functions as marketers. And this is all fueled by the rise in digital transformation, digital adoption, but it's also fueled by just consumer demand. And what is their expectation? What are patient expectations? Because they're now accustomed to encountering you and other brands and other aspects of their life in the digital world. And so that's things like they expect for you to be found on a digital platform. They expect for them to make an appointment that's convenient on their terms, that they can self-navigate through that process. They also expect for the information to be readily available and transparent so that they feel confident they can make the right choices about the healthcare that you provide. And they want everything to be seamless. They want this journey to be just as simple as it is in finding shoes or travel or restaurants and every other way that they are encountering brands digitally. So in order to think about patient journeys, we often say as marketers, oh, just meet the patient, meet the consumer where they are. And that's a great way for you to say, okay, we can find out what they need at that moment and then just give them the experience that they're expecting. So it makes perfect sense. It's logical. It makes a lot of sense from a marketing perspective. But we all know that these journeys are actually omni-channel in nature. There are many different ways that they're encountering your brand. The experience is quite complex. They're looking at you through apps, through mobile phones, in-person walk-ins, calling you over the phone. They're doing everything that they can to get access to the care that they need in the time that they need it. And so as we think today about this journey of the journeys that patients are encountering, I want you to think about all the different touch points that you have access to or that you know about as a marketer that would then change the way that you provide information or that you provide an experience. And write down actual names. Write down names at your organization that you might think about that could be great collaborators in this experience. Because as we know, brands are changing the way they operate daily. And so this is going to take really quick, real-time thinking that hopefully you can impact your teams and change the way you work and change the way your teams work today. So let's change gears and turn it over to Joanna so that Joanna, can you give a sense to the audience of a little bit about patient journeys at university hospitals so we can understand your role and the complexity of what you deal with?
Yep, so those of you who are not familiar with university hospitals, we are a large healthcare system in Cleveland. You'll see from that first bullet there, we have over 20 hospitals and we are in over 16 counties throughout Northern Ohio. So quite a big healthcare system. That comment about silos and making sure that we function like a system is very important for us as we're trying to reach a variety of different patients and patient experiences. Again, just to give you the scope, we are about 500,000 monthly appointments across that system. Those are anywhere from ones with orders to patient-driven to referrals, so a whole variety, obviously, just like any other system. We have done quite a bit of online scheduling. You'll hear about that a lot today. It's a big piece of how we in marketing help in the current environment. About 22%, there's been about 22% growth in our online appointment scheduling over the past year. We do spend some time looking at new versus existing patients. About 14% of our patients are new to system. That means that they haven't been anywhere in our system in 3 years. And we actually look at that for our marketing driven appointments, and it's actually closer to 23%. So we do know that what we're doing from a marketing standpoint is bringing in new to system patients, which are really important as we're looking to grow our volume and our revenue. And as much as we talk about volume and revenue, it's also about really getting people the care that they need. And 13% of all those 500,000 monthly appointments do come in through marketing touch points. We do a lot of data analysis to understand what marketing drives. It's very important. As all of you are going through revenue and financial challenges, and I know that will come up throughout this presentation, it's very important for us to show how marketing is impacting those 500,000 monthly appointments, how we're helping to drive revenue, and the importance that we have in getting people the care that they need.
Excellent. So that's a great overview just to understand the context. I'm sure many of you can relate to the number of different locations and systems that are now a part of Joanna's scope as a leader of her team, and thinking about how hard it is really to kind of orchestrate all of this in a timely manner, in a very accurate way. And so knowing that will just help to give a little bit more context to really just how sophisticated this approach really needs to be. And so let's take a step back. So now we can see that from kind of an internal perspective within the organization of university hospitals. Let's talk about some outside forces that may likely be impacting all of your work as marketers and in the healthcare space for sure today. And so a staffing crisis, number one, is impacting your ability to provide that care, to provide that level of care that consumers and patients are expecting. They're reaching out to you to be well. And we know that recruiting the right staff members and being able to fulfill care based upon the volume that's coming in is a real struggle. This is impacting almost every organization, but not impacting every organization, but made even more complex within the healthcare space. Given the care that you provide, given the sensitivities and the urgency, we know that it's also causing a lot of strain, a lot of overwhelm within your systems. And so this is a real challenge that is impacting you likely today. But I shouldn't have to tell you that there is also a surge in illness that is likely impacting the volume of patients that you are seeing on a daily basis. Not only the volume of patients that are scheduling appointments, but those that are walking in and seeking care immediately. It's leading to long wait times. It's leading to overwhelmed and crowded care centers. That is really hard with that first bucket there to provide when staffing is limited. And so this is all being even more made more complicated with the economic forces that everyone is facing. It's leading to tighter marketing budgets that are lending themselves to the scrutiny that Joanna's talking about, which is doing more with less. And can you prove that the money that you're using is actually driving measurable growth? Is it leading to a return that is then that is justifying the investment that you're making? And is it changing the way you're delivering these experiences? Is it meeting the expectations of these consumers? And so you can see how all of these things now compounded. You've got internal struggles, you have patient expectations changing, you have all of these macro forces impacting your day-to-day. And so it's really challenging. There's a lot of underlying context here that's making your jobs even more difficult. And so let's turn it to Joanna, because we definitely want to leave you with a sense of hope and not despair. We want you to feel like marketing can actually make an impact even as of today and change the way you work in order to alleviate some of the burdens that we just talked about. So Joanna, help us understand what practical ways that marketing can make an impact.
Definitely. So the first thing that we'll talk about is online scheduling. I did mention that our online scheduling is up 22% over previous year. As Jen mentioned and I'm sure all of you are dealing with the staffing issues at call centers, in offices, the more we can get people to schedule online, we can alleviate that pressure from the call center. And there's a few different ways we've done that. One is through our paid search and our paid social ads. We encourage people to schedule online so they can click directly into visit their provider and make that appointment. They can also look for a time that's convenient for them. So this idea of personalization, this idea of customization, people wanting ownership. They're going to go, if they can schedule online and they can see available times, it gives them that ownership. Now, we know that not everybody is comfortable digitally, or they're still making those phone calls. One of the great things about our partnership with Invoca is we have a lot of flexibility within those calls. So we also often, when people call, we give them the option to get a text message with a link to schedule online. So maybe they call and they know there's going to be a wait time, and so they can press a number, they get a text message, they can open up that link on their phone and schedule online. So again, the more we can alleviate that pressure from our call center, and the more we can put control into the consumer or the patient's hands, the better it is for us. The other one, I mentioned this a little bit, is routing calls. So we do have the ability, and we get people to schedule online through text message. We also have tried out a few things of, if you already have an order, maybe you press a different number to get connected directly to schedule that appointment versus if you don't have an order. So we found that's really effective with something like a mammogram. If you've gotten your order already, you don't need to go through the routine with the call center to explain why to get that order. So any way we can route calls, that will also help, again, to get people, not just to reduce hold times, but to get people directly to what they need, which actually the next bullet on here talks about that, about prioritizing complex calls. We've tried out we're testing out a couple of other different things, again, with Invoca, one of which, if people are searching for certain cancer terms, they can bypass that IVR and get connected directly to an agent. We know people sometimes get frustrated with that IVR, especially if you're dealing with something as life-changing as a cancer diagnosis. The more we can connect people to the right place, the better. The other thing that we're working on is, if you come in through a marketing vehicle and you've been on one of our websites, that web page will get sent to the call center. So the call center rep can understand exactly what the patient was looking at before they called. So this idea of consumer-led, consumers are making more and more decisions, right? They're used to the Amazons of the world where they are more in control. And so the more we can do that through the calls and make it more personalized and put them in control, the better. So there's just a couple of examples of where we've leveraged both our digital tools as well as some of our phone tools, and even merged them together in that patient journey. So we know that people reach a number of different touch points before they even make a phone call. So how do we impact them through those variety of touch points?
That's fantastic. So the way that you are able to think about this through the lens of what the patient is experiencing versus kind of forcing an experience, based on what you're either, what you have access to or what you have in place, rethinking that a little bit more and saying, okay, what is the patient encountering? And then how might we as an organization make that process a lot more simple? So that's really excellent way to utilize, the insights that you have. So let's change gears. Actually, let's talk about a story here, because as we're talking about making that impact, university has had some great success with that, and measurable numbers. I'm sure everyone will really appreciate hearing the story.
Yeah, so another digital tool that we've been leveraging a lot more in recent years is email. And the way we leverage email is that we do have access to our consumer data, our patient data, and we can search for a variety of different places where they're behind in their care. Is it that they are due for their annual wellness exam with Medicare? Is it that they are due for a mammogram? When the guidelines changed for colonoscopy, we could look for patients over 45 years of age, or who are just turning 45, and we can send them an email. And we know that people, they want things that are personalized. They don't want to feel like they're getting mass marketed to. And so especially in the case of the annual wellness medical exam, for example, we already know who their primary care doctor is. So we can personalize that email, put their name, address it to them, but also link them directly to their primary care doctor, whether it's to click online and schedule online or to call that office directly. And so when you see that those huge increases, that is because we're able to personalize and customize the experience. So rather than sending people to a call center and having them figure out who that primary care doctor is, we can have them call them directly. And so we've reduced that hold time and increased conversions because people feel like they're being spoken to. They understand what's coming in. And I do see a question on HIPAA. I saw that pop up, so I am going to address that. We've had a lot of conversations with our compliance, and because we are helping people get care, we are looking at this as it is a care driving initiative. We're not necessarily, it's obviously a marketing initiative, but it's really about getting them the care that they need. And so we in marketing have all the same PHI and HIPAA regulations, but we follow those, and we will hold that data closely, but we make sure we get it to those individuals.
Awesome. Thanks for addressing that as it's coming in, because I know that question will come up no matter when we open up to questions. So hopefully that helps. What I love about this slide is, as we are talking about that third macro force of budgets and the economy and really just economic pressure, those numbers really speak to not only being able to drive top line growth, but also cost savings. Reduction in hold time is likely one of your most expensive resources from a customer care end, from a marketing spend. These are people that are answering the phone, and how do you help to make that experience shorter and more powerful for when they do make contact with you over the phone? So reduction in hold time, I'm sure we can all appreciate that being a change you're making. And then the conversion rate, as you talked about, the scheduling, the thing that will then drive impact to growth is, are they coming in? Are they able to schedule an appointment when they need it? And so thinking about these two things as we transition to this next slide, talking about.
While you're talking, I can talk to it here. So talking about budget is, it's that transition as well. The nice thing about email is it is, obviously there are fees to set up Salesforce. There's, people resources, but it's definitely a different budget than, paying for paid search or social media or any other marketing initiatives. So it's been a great way for us to reach out to our patients and get them the care that they need in an inexpensive but efficient way. We also leveraged it a lot, quite honestly, in the middle of COVID, when people had procedures that were pushed out. We could reach out to them through email. And I think that goes to the previous question of, where is this from a HIPAA standpoint? Sometimes during COVID, we were reaching out and just saying, hey, we're still here. We understand that things, you may not be able to schedule, but make sure you're still taking your medication. You're still seeking care if you need it. And so email has really been a great way for us to retain our patients and to stay connected to them, and making sure that they get that care that they need.
Excellent.
Another great example from a budget standpoint is colonoscopy. I mentioned that from an email standpoint. So we have sent out emails for people who are needing colonoscopy, but we also know with our staffing concerns that we've had issues with access. And so in terms of knowing where to allocate ad spend, we've been able to geo-target where there is access to get those scheduled. We can turn on and off different different media and different zip codes to make sure that we are sending people to places where we're able to get them scheduled.
Great. So these are really good ways to rethink your impact and like really your use of the budget that you get. What are some other ways that the marketing data now is then informing that personalized experience or the optimization or scheduling?
Yeah, so obviously personalization, I've mentioned, email has been a great way for us to personalize. And I think that the other thing with personalization is sometimes it's not that granular. So for example, we have a pediatric network as well, and we have over 150 general pediatric practices throughout Northeast Ohio. Well, what we've learned is if we say we have 150 pediatric practices across Northeast Ohio, people tune it out. They say, great, good for you. I don't know if you have one near me. What we've started doing is creating display ads. We've split our region to 5 areas, and we have a different ad running in each of those markets that lists a couple of the communities in that market. So we might say, those of you know Cleveland, we might say from Shaker to Mayfield, we have pediatric practices for you. And we found that we got much greater engagement when people saw their community listed, and then we're able to send them to the practices in that community. So it's this idea, especially as you're talking across multiple counties and multiple practices, people might say, oh, well, you're so big, I don't know. You say you're in my community, but are you really? And so the more we can geo-target and send people, whether it's in the ad itself, communicating that we have something near them, or when they click through, making sure that they see a location or a provider that's in their community and not 30 or 45 minutes away. So that's something that we've definitely looked at in terms of personalization, and we've seen it to be really impactful. And that works from an optimization standpoint too. So again, Shaker and Mayfield are on the east side of Cleveland. I'm not going to advertise for those on the west side. I'm going to advertise west side communities. And so that gives me the ability, again, to optimize my spend and make sure even how much I spend in those markets based on how big the community is, how many practices they have, whether or not they have access. So again, if right now with staffing issues, if I know a location doesn't have access, I don't have to turn all of my advertising off. I can just turn it off in the area where I know that I have an access problem. And then we've talked a lot about scheduling. Getting them to online scheduling is our first priority. The more we can alleviate that pressure from the call center, the better it helps our call center to spend time with the people who do need the time and have the questions and get them the care that they need.
Excellent. Thank you for sharing those practical tips and how you've done it at university. I want to, because you've been talking a lot about this kind of cross-functional access to insights, because it really likely isn't just your team that is seeing this data or curious about this information that you're getting from the patient experience. And the way that I'm starting to see this look is that it is really just like piecing together pieces of a patient profile or piecing together pieces of the patient profile, where they are in their journey. And it is more than just a feedback loop. So not only are you able to kind of pass it on to the teams that might need access to it or might change the way that they roll out a campaign, but it's really thinking about putting yourself in the shoes of that patient. And so we like to think about this as empathy at scale. How can you put yourself into the shoes of a patient and then provide that compassion and level of kindness and care that patients truly need when they reach out to you? Because we know that that's probably core to your mission at universities, which is like helping people feel seen and feel heard, and then making them get well. And so when we think about empathy, it's not just a feeling, it's not just words, it's not just a script, it's truly matching where they are in their journey and thinking about how to serve them better. Does this slide tell us about how you've been able to, at university hospitals, kind of share the data, share the information so that it's not just marketing, sitting at your desks and doing your things alone. In fact, it's actually driving organizational change.
Yeah, and I think that's something that we find really important. And I've given a couple of examples, even in the current situation with access of, we also don't want to advertise a service where we know that it's going to be 2 or 3 months till someone can get something scheduled. So the feedback loop does go both ways, and that we want to make sure we understand from the clinical side, what can we offer, what experiences are people having, we want to make sure that they have that positive experience. And then on the flip side, if we start to see trends in data, we also listen to phone calls. And when we listen to phone calls, we learn a lot about what experience those patients are having. And we'll provide that information, whether it's quantitative data or this qualitative data, both to the call center to say, hey, listen, people are asking for this location and your call center is not able to give it, or they're asking about our orthopedic injury clinic and our call center doesn't know that exists. Let's make sure we educate them. Let's give them the information. We also might share it with the service line as well to say, hey, we're hearing that people are requesting this service a lot, or you know what, you've created this rubric for how to determine what service a patient needs, but both the call center and the patient don't completely understand it. Maybe we need to rework that. Or people are calling at this hour and we don't have the right staff on hand to answer that. So trying to make sure that feedback loop goes both ways, because we also want to make sure that, to your point, we're not sitting in our silo saying we're just going to start advertising all the services that are offered when we know that there's more nuance to it than that. So it's definitely important with such a big system, or even a small system, to make sure we're communicating around and across to really build that systemness.
Yes, really great point. Let's talk one more story here about these improved patient experience and just kind of the business results that you've seen.
Yeah, so this is a bit of an old quote, but it still holds true. So probably about 4 or 5 years ago, we started making a concerted effort to directly link all of our marketing efforts to appointments. Invoca has been a key partner in that. So we're actually able to track all of the phone calls that come in through marketing efforts, as well as any of our digital efforts, and link those to whether or not we have seen appointments come in. So when we talk about our ROI or an increase in appointments scheduled, we're not modeling that number. It's an actual number of what appointments we're seeing come in directly from our marketing efforts. And that's been really key in terms of showing the value of marketing. The days when impression numbers were the key to marketing are no longer the case. As much as we get asked, we need a billboard, we need TV, or being asked for tactics, we can come back and say, here's what actually will drive appointments. What goal are you trying to achieve? If it's growing appointments, this is the tactic that's going to help with that. And what we've actually found is that even in the current state of tight budgets and figuring out where to put resources, we've really shown the value of those marketing dollars in driving revenue, in creating a positive patient experience, and putting control in the patient's hands. And so we are continuing to have the support from the system and system leadership to continue our marketing efforts, because we've been able to show through partnerships with vendors like Invoca that we actually are driving appointment volume from our marketing efforts.
Well done. Well done. This example to me shows kind of the approach that you took, which is not just marketing related, but really throughout the entire organization, and really trying to serve the patient with that all important appointment that they need. That is most often the reason that they're calling or they're reaching out to you on digital ways. And what's interesting and really impressive, the way that you've been able to think about this, is that marketing's role is to inform the journey leading up to the appointment. It's to be in the places that they're seeking care when they're at the very beginning of this journey. It's having relevant information on the website, or being able to send emails in a timely way, or provide them with information that could be more proactive in nature rather than just responding to something. So all these things is that's marketing. And then obviously that conversion event is the appointment scheduled, but how does marketing rethink the journey that leads up to that is just kind of the really nice way that you've been able to tie all the groups together. So as we kind of move into additional ways, because I think you've been really, really thorough. I think you've really demonstrated that you all are thinking about this in many, many different ways and kind of reframing your perspective. Let's talk about all the other ways, because I think everyone would love a sense for what else could we do? What are some low-hanging fruit, or what are some other opportunities that we might be able to implement at our own organizations?
Yeah, and so I've hinted a couple of these, and I'll give some examples, and some are calls and some are other marketing efforts. And I think one of the biggest ones is, as a lot of you during COVID, we shifted from in-person health talks to virtual health talks. And we've really been mining our marketing for what are the topics that are important to people. Sometimes we hear them in phone calls, sometimes we see them comments on social media posts. Sometimes they're direct messages to our social media channels. And so when we get those, they give us a chance to answer that question at a broader scale, similar to a call like this. You know, people want to know what the patient journey is. How do we leverage that? And so we listen for those things, and we might have a health talk or a webinar on those topics. We may also say, you know what, it's a great blog post. This is great educational content that people can come back to again and again. Or maybe we learn from our click-through rates on our paid search ads or our conversion rates that we're not answering the question that people came to us for. So do we need to add more content to our website to make sure we're answering that question, that we're getting them to the place that they need, even within our system? Can we do that before they even pick up the phone, so they know which specialty do they know to go to, which provider do they want to meet with? And again, that can be a variety of different ways, whether it's listening to phone calls, looking at comments on social media posts, or even the FAQs during a health talk. So taking all of the different information and the different ways that patients talk to us, because they tell us things all the time. It's just, how do we listen to that information and then give it back to patients in a meaningful way?
That's great. And so I think as we kind of look to the future, as we think about ways to reimagine really everything in the marketing world, I, number one, first like to thank you for sharing your insights on kind of the today and the now, because we know that these problems are not going to go away overnight. They'll likely be here for a while, and it's now important to now more important than ever to kind of start making that meaningful change that you talked about, and collaborating across teams. So that's really excellent. I'd love to end on an encouraging and optimistic note about the future of marketing in healthcare. What you think as a leader in the space of what's coming next and what people should be thinking about.
Yeah, so I laugh at the first one you put here. I know we talked as we prepared for this presentation, and one of the things I always tell my team and the department and even others that I work with is marketing is about solving the consumer's problems. We often think of it as a way to solve our problems as an organization, the challenges that we're facing. And it still can be, but really, what are the problems that the consumer is facing, and how do we help them solve that problem? Our organization should be structured, and we should try to think about how do we solve the problem for the consumer. And that's where even I made the joke about, physicians come to us and say, I need this tactic. Instead, what are we trying to solve? What are we trying to do? And I think that helps us be better marketers, better strategic partners, and really helping our healthcare systems through the challenges that we're facing right now. And I think the second too, I somewhat group together, we talk about consumerism. It's going to continue to be an issue, especially in healthcare. I joked about people are used to Amazons of the world where they get personalized recommendations. They click on a link and it sends them something tomorrow. So the more that we can understand that consumer, solve their problems, makes them know that it's for them, it's in their community, it's for the specific condition that they need, it's a physician that understands them. So the more we can personalize and customize and make our consumers feel heard and wanted, I think the more it's going to help us succeed as we face the challenges that healthcare is facing.
Wonderful. Well, thank you so much. I think that concludes the main portion of our presentation, but we do have time for questions in there. I see there are many. And so I guess I will turn it over to Daniel to facilitate this section. Thank you, everybody.
Thanks, Jennifer and Joanna, for that terrific presentation. We do have several questions already. And as a reminder, as Jennifer just said, if you have a question, simply enter it into the question and answer pane, and we will get to as many as we can. Our first question from the attendees is, what technical tools do you use to have the contact center know what a caller's looking at prior to calling? Is it a combo of Invoca and the CRM, or how are you guys tracking that? I guess Joanna, if you want to start with that.
Yeah, and I may pass it over to Jen. It is a tool I think Invoca has been testing out. So I did peek. So Invoca, for those of you who aren't familiar, it is a partner that we use to track all of our calls. It's one of the things we get probably the most questions about from our physicians, because it puts a trackable phone number. It sort of sits on top of the existing number. So we hear all the time, my phone number is not right. Like, no, it's right. You just need to call it. But when consumers call that number, it actually tells us where that phone number came from, like where they were. Were they on paid search? Were they on the website? Did they get to the website from organic search? Did they get to it from paid search? And so it tells us where it's coming from. It also has a lot of tools within the dashboard where we can listen to those calls. We also can set up AI to look for certain words. So rather than listen to every single call to see if they scheduled an appointment, we know there's certain words that the caller will say or the rep will say that imply that it's an appointment. So there are a lot of tools that we use that resource for to help us understand where people are coming from, gives us the ability to listen to calls, to filter calls. And there's a lot of other tools that they're trying out, which again, I think Jen can share a little bit on, that we've been trying out with our call center and with our different areas in the system.
Sure. Yeah. So you definitely touched on it. All those marketing channels where the phone number sits. So whether it's in a paid ad or it's on a social page or it's on your website, those are all trackable through Invoca. And so that insight of where they came from, what keyword they actually typed, is now then a part of the caller experience. It's part of what the agent could see in order to either route them automatically, as Joanna talked about some of the IVR capabilities of like being able to dynamically send them where they need to be based on that behavior, or using a script or specific words that are now repeated back to the caller, because now you know that they came from a certain page and those are the words they typed. So those are just some of the ways. The other piece of this is like sort of like integration with contact centers is quite important when you talk about how the agent is kind of handling this and how the agent is now serving the patient in that moment. This is where you can kind of start to think about how the agent could change his or her performance, or how you as a contact center manager might say, these calls are going well, these are not going well. And so those are some of the things that might impact the way the call is handled. I see
Great.
lots of others.
Yeah, we've got a bunch here. And sort of building off on one of those capabilities, you've said you've listened in on calls. We have a question, just sort of, could you go a little bit further in depth on sort of what does that mean exactly when you say listen in on them? Thank you.
So with the Invoca tool, it does record those calls, as well as where the call came from, both the marketing side and the phone number. And so we're able to listen to calls based on, you can group them by campaign, by destination phone number. There's a number of different ways, and they are recorded. And so you can listen to those calls. You can also save them as an MP3 file and send them on. Obviously, it can be a little sensitive. So it's something that we've had to really work through of, you're not trying to get call center reps in trouble. There's no, we're not trying to do it as a gotcha game. It's really, we're trying to do it as a way to understand that patient experience. And every once in a while, we do hear that a patient doesn't get where they need to, and how do we resolve that more in, it's usually a holistic issue of everyone's moving a mile a minute. If we made a change in a location, did we educate our call center on that change? So again, it's in the spirit of making sure that we're doing what's right for the patient and not trying to call out anyone on the experience that they had.
I'll just add, in case the person that asked it, wants to know exactly how that technology is working. This is where our AI capabilities are doing that analysis at scale for you, because it is, some people are listening to calls manually and scoring them, but of course you can understand the complexity, but also just the subjectivity to that. So this gives a data-driven way to kind of score and assess and understand what is actually happening on a call, so you don't actually have to listen to every single one. So this is where technology comes in, and for organizations of university hospital size, like it's necessary. So
great. And I guess, just building a little bit off of that, with the recording and listening, does the patient know they're being recorded as they share health information?
Yes, I believe that's part of the intro, and then it is fully HIPAA compliant. I know there's a number of healthcare systems that use Invoca. I don't know if Jen has more detail on that, but I know we would not have partnered if we thought there was any concern with privacy or HIPAA in this process.
Terrific.
Yes. If there are questions about that aspect of it, I would hate to shortchange that answer, since I know it is so important and really, really critical to this process. So please reach out to me or Joanna directly, or sorry, not Joanna, but you can reach out to me and we can answer those questions for you, because I know that it's not just one word answers that you're seeking. So
That's great. Thank you. Another question for Joanna. An attendee would like to know what piece of your marketing budget gives you the most bang for your buck, if you could share.
So I would say paid search is our biggest, most effective marketing vehicle. When we had very little budget, that was where we started. It is the easiest to track in terms of conversions. It is the closest to the appointment. You could make the case, are people searching anyway, would they have come to you in the first place, but they may not have found you, you may not have been at the top. So I would say paid search would be the thing. If, when we had very little budget, that was the first place that we started in terms of spending, and then sort of layering awareness metrics on top of that. So again, digital metrics, mostly things like Facebook and display ads. And we do find that when we run Facebook or display for area, we see paid search become more effective. So as we layer awareness metrics on top of paid search, we find that we may not get appointments from those vehicles, but our paid search becomes more efficient.
Great, thank you for that. Another question from an attendee. Have you gotten any insights from any failed appointments when a call center rep isn't able to complete an appointment?
That's probably where we get the most insights, quite frankly. Again, I want to be cautious, because my goal is not to get anyone in trouble, or it's not that we're, things aren't working, but we'll hear things about, recently we found out that one of the areas, the schedules weren't open for 2023. And so the call center was having a hard time getting people booked, because we were booked through the end of the year. And so we were able to reach out to the service line and say, hey, listen, we're hearing this in calls. Here's a couple of examples. We don't know if that's all the locations, or maybe you are open and the call center reps aren't aware of it yet, or they're not able to see it. So when we listen to those types of calls, that's where we're able to provide that insight. And the other thing that we found, and I don't know, other healthcare systems are similar, you can show the data, but sometimes hearing that person's voice or hearing that example, that one example, even though it's qualitative, puts color and context to that experience, because we all are patients too, and our families are, and so hearing that person try to have that, schedule that appointment and not being able to do it, that's where we're able to link that with the quantitative data and make it much more impactful. Or maybe to Jen's point, we heard one call that someone said they couldn't schedule until next year, but then we look and that's an anomaly. From the AI, we're seeing that everybody else was able to schedule, and then it gives us the insight in the reverse side that, like, hey, we heard that, but maybe it's not universal. It's just that one person or that one day when they called. So we definitely use those calls to inform the service line to say, hey, this is that somebody was trying to schedule here. And sometimes if it's a really big issue, we'll actually give that patient's information to the service line and they'll call them back directly. So we've had that experience as well, where someone is really struggling, maybe they have a very specific need, and that call center reps they're not clinical, so they are not able to provide that resource and that information. And so we can give that person's phone number directly to the service line, they can call them and give them that one-on-one patient experience that they were looking for. So there's definitely a lot of opportunities to leverage those calls. You could easily go down the rabbit hole and listen to a lot of them, but to Jen's point, you are able to group them together, and sometimes you get those little nuggets that are really helpful.
Well, thank you for that. Another question, not to keep you talking so much, Joanna, but the audience loves hearing from you. Are there changes
Happy to do it.
Are there changes you made or implemented during COVID that have become a mainstay in your marketing now?
I think the health talks are really the biggest one. With a 16 county spread, we would have, for example, a health talk on orthopedic surgery, and we have to pick which location are we going to have it at, which provider is going to do it. Do we do them all across the system? It can get expensive. You're sending out flyers, and we started doing those virtually, and we found huge success. And we also found that the provider who is giving that talk isn't always the one who, they will get more of the appointments, but people might book across the system when they learn about, they learn more about joint replacement and what it means and what to look for and what to ask their provider. So we found that it helps throughout the system. So we've brought back a few in-person screenings, but for the most part, we've really kept our health talk. We've kept this just like this with a webinar. We've kept a lot of these, and we still do probably 3 to 5 a month on a variety of topics.
Terrific. Following up a little bit on the question just before that last one about matching sort of calls and data to patient data. How do you match the Invoca calls and data to the patient's data?
Very carefully. No, there's we have an analytics team, and they're much smarter than I am. And healthcare data is not clean or easy to use. So we're constantly working through it. So there is information, you get phone numbers and some other information from patients through those calls. And so it's linking that to the patient. But again, that's sort of done behind the scenes. And I just get to go through a database and look at the outcome. But it has been a lot of work, and it's been going on for a number of years, and it's continuing to. But we continue to get better at it. And in the case of marketing data, some is always better than none, and it's directional and really helps us to guide where we need to go.
Thank you for that. Thank you for that. We've got another question. How would you respond to the concern that auto-generated phone numbers can be sunsetted? So if a patient saves the number in their contact list, they later risk getting a number out of service error message.
We get that question frequently as well. I don't know the data on it, but click to call is becoming an increasingly used. So a lot of people will, just press the number on their phone. So again, there are some people who save them. We tend to look at how many calls have we gotten in a certain period of time to a number before we will reuse or sunset that number. So it's not a perfect answer, but that's the closest thing that I can say is we try to look and see, are we still getting phone calls to that number? And if we are, we'll keep it linked. And we won't discontinue it or move it to something else unless we see no calls come in. I don't know, Jen, if you have another answer for that.
That's very well said. I think we can leave it at that.
All right, Joanna, another question here. What would you say is the biggest issue at university hospitals that always gets pushback?
Well, as I joked, Invoca numbers get a lot of pushback. I think we finally worked through it a little bit, but we get asked that all the time. But really, what we've been working towards a lot is, and I mentioned in the future of trying to solve what problem are we trying to solve? So, when we go meet with physicians or we talk with them about marketing and they come to us with tactics, I need a Twitter handle, I need a billboard. We try to sort of time out and say, what's your goal? Are you trying to grow appointments? Are you trying to build reputation? And when you say reputation, what exactly do you mean? And really trying to get granular on what are they trying to accomplish? What are they trying to achieve? And then let us help you put together the tactics that will help you get there. Some are better at going that route than others. But again, I think that showing the value and measuring everything we do has helped us to move the organization in that direction.
Well, that's great. And I think with that, we've answered one more question. I think we have time for one last question. Can you tell us a bit about your marketing stack you mentioned? A little bit about it?
It sounded like you said marketing snack, and I like snacks, but I don't think that's what you
marketing
said.
stack, sorry, like the marketing
marketing stack. Yes. So we do use Salesforce for email. I'm looking at the quote. We've used a number of different things to showcase the data. Right now, we've been in Domo has been our recent display for that. Invoca is a big piece of it. We do work with Yext for Google listings, because we know that's a big piece for us. And then we have a couple of agency partners that we work with on the channels. So I don't know if you're looking for that, but I think more of like, what are the tools that we use? I think those are the big ones.
No, that's great. And I think now we've answered all the questions, taken as much information from you as we can in the time we have. So we've come to the end of that time. Joanna and Jennifer, I'm sure the audience joins me in thanking you for sharing your insights and expertise today. And thank you to everyone in our audience for taking the time to join us for this important discussion. Please note that if you asked a question that we weren't able to get to, we'll do our best to get you a response. We'll also be sending out a link to the webinar recording. Watch for that within the next few days. That concludes today's program. We hope to see you at future forum webinars, as well as the Healthcare Marketing and Physician Strategy Summit, April 17th to 19th in Austin, Texas. Please visit the forum website, healthcarestrategy.com, to learn more and to register. Finally, be sure to give us your feedback by completing the evaluation survey as you exit the webinar. Thank you and have a great day.